Good morning. I'm Gail Gage. I'm a clinical aromatherapist who works with cancer patients here in London, Ontario. Today I'm going to be speaking with Tammy Freer about her journey through breast cancer and how complementary and alternative medicine has helped her through the last 4 to 5 years. In addition to that, we will be speaking about a pre-radiation radiation cream that I have developed which minimizes burning and help people who have gone through radiation to heal much faster and more completely. And I welcome Tammy. Come on in, Tammy. Thanks for joining me today.
Thank you.
We're going to talk a little bit about your journey. I appreciate your agreeing to sit and talk with me about that, and hopefully through our conversation we'll be able to help many others who are taking the same or similar journey.
My pleasure.
Great. So can you tell us a little bit about when you were diagnosed with breast cancer?
I had found a pea-sized lump in my right breast and went to the doctor, and upon examination they decided that I needed a mammogram. And from the results of the mammogram it was determined that I needed a biopsy. So when the biopsy was finally done, the came back with a positive malignant diagnosis. And at that time, they decided that they would do a partial lumpectomy, but just prior to the surgery, they decided to do a full mastectomy of the right breast, remove the entire breast. After the surgery, they had discovered there was 2 tumors, which they successfully removed, and removed some lymph nodes also at the surgery.
Now, did you have cancer cells in the lymph nodes as well?
Yes, it was positive.
Okay, so did that then mean that you needed to have chemotherapy and radiation?
Chemo and radiation were the protocol that I was to follow.
Okay, so between having your surgery and having your chemotherapy and radiation, how much time would you say sort of elapsed?
From the time of surgery to my chemo my surgery was in November, and I started my chemo, I think it was the following February that they started the chemo.
And then you had your radiation after you finished your chemo?
Correct.
Okay.
I had, I think 30 or 24 sessions of 5 days a week. So maybe it was 20, I can't remember how many sessions.
It was a lot.
It was a lot.
And it was cumulative. That's great. Well, I appreciate you sharing that information. Now, during that time, you had sought traditional treatments for breast cancer. You'd had a mammogram, you had chosen chemotherapy and radiation, but you also chose to pursue an alternative and complementary route. Why was that?
I just felt I wanted to give my body and myself the best possible chances. And I always had a tendency to look at naturopathic healing along the way, but not quite as dedicated as I became once I decided to really follow that path and journey. So in saying that, I talked to my doctors about alternative, complementary with the regular medicine, but it wasn't something that they chose to talk to me about or discuss about. They didn't really know a lot about the naturopathic healings, and of course as doctors they can only tell you what they know.
Absolutely. Yeah, doctors today, for the most part, particularly here in Canada, don't receive training in, or much training in alternative and complementary medicine. Third-year medical students here at Western University, however, do have one session sort of at the end of their third-year term that covers some of the things that are offered, like Reiki and reflexology. Essential oils are sometimes touched on. There's a tremendous amount of research today all over the world, Australia, Europe, England, North America even. There's many places within Canada, US that are doing essential oil studies, and most allopathic medications actually evolved from the use of plant botanicals. So it's not unusual for them to sort of stay within their own field and think that a synthetic or a pharmaceutical might be the best route, whereas in nature everything is perfectly buffered, perfectly balanced. Not benign, mind you. You know, they're a natural pharmaceutical, but nature has a way of looking after that very delicate balance of chemotypes within a plant that provide healing. consequently protect the plant in nature, and therefore why would they not protect our bodies as the plant within our natural environment? Now, you came to me, and how did that evolve?
I had a friend, well, she was actually a family relative who was going through cancer herself, and she was basically my mentor. She was helping me get through, and not just the physical aspects, tell me the things that she had gone through, but the emotional aspect of going through that whole journey. And once we got talking, she referred me to you.
Lovely. Yes, and I think we know who that is, but out of respect for her, we'll not mention her name today. Just to say that she was a beautiful lady who had an incredible journey, and it was a privilege, I think, for both of us to know her and have her in our lives.
I agree.
You came to me, and one of the reasons I think that you came to me at that time was because of a cream that I had developed, and you were looking towards radiation.
Yes, I finished my chemo and was just beginning my radiation. I had come down to London to the lodge because I lived out of town and was having daily radiation treatments. And my concern was about the burns. The doctors talked about these burns you could get with the radiation. And just from talking to other people, the depth of the burn, the degree of the burn that you could get from the radiation, the potential of it, really had me concerned, because I thought, the tissue's already been traumatized by the surgery, the removal of the breast, the tumors, the whole aspect of the cancer being there. And I realized that I had agreed to the radiation, but I was still concerned with damaging the good tissue that was still remaining.
Well, and I've dealt with a lot of people who have had that concern, not just breast cancer patients, but also others who've had to receive radiation for throat cancers and bowel cancers and things of that nature. And my initial development of this cream actually came because my dad had colorectal cancer. And when I first graduated as a clinical aromatherapist, my first inclination was to say, okay, I've got to heal my dad. I went around for a very long time, and so I put together an entire radiation cancer kit for him, that I have since used many things for other people. And one of them was the pre-radiation cream, based on clinical studies that have been done in Europe on specific essential oils at maintaining tissue integrity. So I made up 2 creams, and one of them was called pre-radiation, very simplistic. You apply it before you're radiated, and the other was post-radiation, because I don't always see a woman before she's received her radiation, or in your case, I think you'd had a couple of sessions by the time I'd
Yes.
first seen you. And radiation is cumulative. For the very first session you have in radiation, your tissues begin to deteriorate. The whole process of radiation is supposed to be to kill the tumor, to kill the cancerous cells. And unfortunately, it's not discriminatory when it comes to doing that, because it will also kill, the great cells too. So you have a problem with the tissue integrity, which also breeds other things. You have problems with bacteria because the skin splits, or you have problems with pain.
Mm-hmm.
You can develop depression because of the whole process in and of itself. It's very uncomfortable to wear a garment against it. So in developing the cream, I had a twofold purpose in doing so, and I think your experience with it was a great one.